can call the police if I need to,
But why would you call the police?
All right, so I'm back to my question. How much longer are you going to be?
You know, you're just exercising your right, and there's nothing wrong with that, okay?
Thank you. I
Like
appreciate
said,
that.
But, you know, some people, especially down here in the South, I'm just going to tell you, they don't like it.
Can't video in here because of HIPAA violations with our patients.
Just doing a First Amendment audit, are you?
Just taking some pictures and video. That's it.
Okay.
Put a body camera on, don't you?
Okay. What about it?
That means you're taking their picture and video. Are you not?
We'll stand by, just make sure that the peace is kept. But other than that, like I said, he's not doing anything illegal.
Hey, how are you? Who are you?
I'm office manager.
Office manager. And your name?
Tanja.
I'm sorry?
Tanja.
Tandra. No, I don't need any help at the moment. Thank you.
Okay, can't video in here because of HIPAA violations with our patients.
HIPAA violations?
We can't have our patients being seen.
HIPAA doesn't apply to the public. HIPAA applies to healthcare providers, insurance companies.
You're not allowed to video in here. I can call the police if I need to,
But why would you call the police? This is a public building.
I've asked you not to, so.
But this is a public building.
And boom, there it is. The classic escalation line. I can call the police. But here's the legal twist. Calling the police doesn't automatically make someone wrong. The real question is, what law is being broken? This is where HIPAA gets misunderstood constantly. HIPAA applies to healthcare providers protecting patient information. It doesn't magically turn a public building into a no-camera zone. So now the tension is set. We've got policy versus constitution. Sign on the wall versus First Amendment. Who do you think is right at this point?
Just in the publicly accessible areas of the health department. Excuse me, ma'am. I don't understand what's the big deal. They're so quick to bring up it's a HIPAA violation. HIPAA does not apply to the public. It does not. It applies to healthcare workers. Not filming inside of any doctor's offices or anything. So quick to call the police. So there is a sign right here that says no pictures, videos, or recordings allowed. I just don't understand how that sign...
Okay, pause right here. This is the legal chess move. A sign saying no recording doesn't automatically override constitutional rights in a publicly accessible government building. Courts usually look at something called a public forum analysis. Is this space traditionally open to the public? Is it government-owned? Is it being used like a lobby or waiting area? Because if it is, restrictions have to meet constitutional standards. They can't just be posted on laminated paper and called law. But here's the real question. Is he educating or provoking? Drop your take.
Because it says respect our patients' privacy, how that sign overrides the First Amendment of the Constitution. Freedom of press. I'm just in publicly accessible areas. What information can I gather? Private information while I'm in public. Anyways, the community room over here. Let's see what kind of private information I can get from this room over here. Ridiculous. No one wants any private information. Just taking some pictures and videos in public. Exercising my rights. That's it. Very cordial and trying to... I don't understand. None of this is necessary. Sorry?
Is there a reason you're out of here?
This is... It's at a community room. I was just...
You need to rent the video or training here.
Oh, I mean, it was open. I just was...
Yeah.
Is this a restricted area?
It's not supposed to be open to the public. We have our trainings out here and our immunizations out here.
Oh, I was just taking some pictures and video. I didn't think it was a restricted area because the door was open. And community, I thought...
No, we don't have the community.
Good. You should change the name of the room. Mm-hmm. Community room, very deceiving.
How we doing, boys?
Hey, how are you?
I'm good. I'm good. Just doing a First Amendment audit, are you?
Just taking some pictures and video. That's it.
Okay, okay, that's fine. As long as you don't take pictures of the patient's files, you're fine.
Yeah, I mean, how would I?
That'd be a HIPAA violation.
Well, HIPAA, as you can, wait, can I just get your name and badge number, sir?
My name is Officer Elmer. It's 841.
Thank you, Officer Elmer. Yeah, no, HIPAA applies to the healthcare providers and insurance companies. It doesn't apply to me.
Well, no, I'm just saying you can't take it of their chart.
Yeah, I mean, that would mean I would probably go into a restricted area.
Yeah. No, as long as you're not in a restricted area, that's fine.
Yeah, exactly. So
the thing is, so you're just doing a First Amendment audit is what you're doing, basically.
no, I never said that. I'm just taking some pictures and video. That's all I'm doing.
Okay.
How you doing, Sarge? Can I get your name and badge number, please?
Yes, Cooper, right here, 810 is my badge number.
What was the badge number?
810.
810. Thank you, sir. I appreciate that.
Okay, so they're just having a little bit of an issue with your recording. Okay. Which,
Yeah,
like I
I noticed that.
And this is the turning point. Notice how calm clarity changes the entire energy. The officer acknowledges public building, publicly accessible area, no restricted zone, therefore no crime. That's huge, because now this shifts from confrontation to conversation. Also, quick legal note, there's a big difference between filming people in public and accessing confidential medical records. One is protected speech. The other could be criminal. Two totally different lanes. So far, who's handling this better?
Yeah, that's why we're here. That's the only reason.
Mm-hmm.
So, I mean,
Have patients over there in the clinic that may have been filmed, and we're not allowed to do that.
Well, they're in public, ma'am. My intention is not to film patients and just stand in front of patients and film them all day. I'm just trying to get the literature of the building. That's all I'm trying to do here. My intention is not to film anything behind your window. Like I said, HIPAA applies to you, so the onus is on you to keep your information and private information safe. And I think you're doing a good job because I haven't seen any. So I haven't seen any private information. So you guys are doing a good job protecting your patient's information. So no issues here.
How much longer do you think you're going to be?
Not too long. Not too long. I just got to get. Just gonna go in that room over there, see what's over there, and just get some more literature.
what type of literature would you like?
Yeah, ma'am. I have to go back in that
So he
room.
doesn't have any business in that room. Okay. So that room's, if you've already been there, then and that's all you're doing, there's really no point in you going over there because that is conduct environmental business. Unless you have any, there's really no point in you doing that.
Oh, I mean, I just wanted to take some pictures and video. That's it.
Okay, well, they're saying you've already been in there, right?
Yeah, but I didn't get all the pictures because the office manager here came out.
I didn't come out till you were back over here. You'd already been in there.
Yeah, I know.
All right, so I'm back to my question. How much longer are you going to be?
I'm not sure. Couldn't tell you, Sergeant. Couldn't tell you.
As long as you don't get any of these people and they don't have a problem with your video, I guess we're fine.
I mean, they're in public.
Well, they're in a place.
You're videoing them right now, not me.
I'm videoing?
Yeah, you have a body camera on, don't you?
Okay. What about it?
That means you're taking their picture and video.
Okay.
Are you
So
not?
how this is going to be?
Oh, I'm stating the obvious.
Okay.
And it's public record, your body camera, so.
As long as you don't go into any restricted areas, because, well, that's what I'm saying. I understand that. But the thing is technically he's correct. This is a public building, okay? The thing is he cannot record medical documentation. He cannot do that, okay? Now, people, we don't have a sense of privacy when we're in these buildings. Now, if they're in a closed door and he opens that closed door like they're in a patient's room, they have
an expectation of privacy.
That's the thing that we come across, okay? I'm just telling you, that's the rights that they have, because they can walk in the courthouse and do the same thing. Okay. They can walk into the hospital.
That line right there, that's experience talking. What the sergeant is explaining is expectation of privacy. In public lobbies, waiting rooms, courthouses, generally, you don't have a strong expectation of privacy. Behind closed doors? Totally different story. And this is where a lot of viral confrontations spiral. People confuse discomfort with illegality. Just because something feels intrusive doesn't mean it's unlawful. But here's the bigger question. Should legality be the only standard? Or should social norms matter too?
Record the whole waiting room, record people. He can walk up to anybody, just like you said.
Thank you.
I have no ill will, ma'am.
We'll stand by, just make sure that the peace is kept. But other than that, like I said, he's not doing anything illegal. If he's taking he starts recording your screens with patients' information on it, that's illegal. Okay. That's,
Thank you.
yes, ma'am.
I have no ill will, ma'am. Sorry.
Well, we know we've dealt with this before where people want to record stuff.
Yeah.
Like I said, you have the right, but we also have to be respectful of each other.
Of course, and I've been nothing but respectful towards you.
I haven't seen you be disrespectful at all. Okay.
To anybody here. That's not who I am. That's not the man my mom raised.
Okay, well, you do what you got to do.
Okay, thank you. I appreciate it.
So, you mind if I follow along?
Sure. That's not a problem.
Follow along?
Yeah, get the door for you.
I appreciate it.
No problem.
But like I said, we just can't record anything that's privacy factor. You know that.
Yeah, no.
You know how this applies.
You've
done your research.
Yeah, I'm pretty. I don't want to break the law. That's my goal. I don't want to break the law.
Because to break the law, then you got a whole different consequence.
Exactly.
So,
why would I want to break the law? I'm a law-abiding citizen.
There's nothing wrong with it, but like I said,
Yeah.
this is being respectful of each other. That's it.
No.
Like
I
I said,
appreciate
respect
that.
what you're doing.
Thank you. I appreciate that. I just
So-
and the way I do it is
Well, like I said, as long as we conduct it in a manner where we're not violating any rights, then, like I said, we're good.
good.
We don't have a problem with people we have a problem with people that want to violate people's rights. Just
Yeah.
like somebody's trying to violate your rights, we don't like that either.
Exactly. And I appreciate you explaining it to them. You did a great job, and it's
Well,
not.
like I said, they can request privacy,
Mm-hmm.
but there's no expectation of privacy in a public place, like you said.
For sure.
Now, as far as their medical records go, you know just as well as I do, you can't record that.
Yeah.
You can't
That would involve me like going back there and opening up their file. Yeah. No, I get that.
You're right. So, but like I said,
If they were, for example, but though, if they were holding it up to the window and I was passing it by and they held it up to the window,
and then technically you're not doing anything wrong. You're right. They're pulling it to where you can see.
Yeah.
It's not being kept private.
What police department?
We're Pell City.
Pell City.
Where are you from, bud?
I'm from New York.
You're from New York?
I'm from New York. Yeah.
Okay.
Yeah. I'm from New
What part
York.
of New York?
Long Island.
Long Island.
Long Island. You've been fair to me. I'm not going to try and be mysterious with you. So.
Oh no.
I appreciate it.
There's no. I'm a Yankee too, so I'm from Michigan. So.
Oh, Michigan.
Yes, sir.
Cool.
So
How long you been down in Alabama?
I've been down here now. Be 12 years.
12 years? Wow, it's a long time.
Yeah.
It's a long
I
time.
still got somewhat of my Yankee accent,
A little bit. I don't know.
but I got a little southern twang here too.
Yeah, little twang.
Little twang.
Little twang.
So what's your YouTube? What's your YouTube video name?
I'll give it to you before we leave. On the way out, okay?
That's fine.
I'll give it to you on the way out.
That's fine.
You've been so respectful towards me, and a lot of the times, to be honest with you, a lot of the times, as much as I treat everybody with the same amount of respect that they give me,
Yeah, that's right.
and it's refreshing to have somebody that's, instead of saying, hey, I'm going to arrest you if you don't turn off that camera and, violate my rights, it's refreshing. So at the end of the day, I have no problems.
Yeah.
It's great. And I appreciate you, educating the office manager here. So now, if this ever happens again, now she knows.
Well, the thing is like I said, they put the sign out there because they're trying to respect their clientele. Okay, and that's what they're doing.
Yeah.
And they're just doing what they're told to do by their boss.
Exactly.
So somebody comes in here, records, call the cops.
Uh-huh.
Okay.
Gotcha.
So that's just it. I mean, and like I said, you have a right to walk around and film anybody in a public place.
Yeah.
Now, you can't go behind restricted doors.
Yeah, for sure.
You know that.
Would never want to do that.
I got you.
That'd be crazy.
So,
Would you mind giving me the CAD number for the call?
that's up to him. He's a sergeant, so I can give it to you. I'm just asking.
Give it to you.
You ready for it, bud?
Yeah, you could just say it. It's
It's
gonna
going
be
to be 2022-053-176.
okay. Great. I just like to have that just in case I need to get the body camera footage or anything like
Yeah,
that.
no. I understand.
Is your whole department have body cameras?
Yes, sir. We do.
Oh, that's great.
We do. We're our department's been a big proponent of it. And
That's
down
great.
here in the South has been
Good transparency.
Well, it is. You're right. You're correct. Just like you had pointed out to that we're recording.
Yeah, exactly.
Because it's protection both of you and me.
Exactly.
Because you could make a false claim. If I didn't have this,
Now
you could edit that video to say whatever you want to say.
Exactly.
See?
Exactly.
Now, this is interesting. Both sides agreeing that cameras protect everyone. This is transparency in action. Body cams protect officers. Personal cameras protect civilians. Documentation levels the playing field. And notice the tone shift. We've gone from, I'll call the police, to mutual respect and accountability. That's how de-escalation is supposed to look. It's rare to see these audits end this calmly. Be honest. Were you expecting this to blow up?
It's a safety thing.
I've never seen a good, police officer complain about body cameras. And if anything, they love them. They're like, hey,
and that's
it gives you more evidence in court.
I've always been that type of person. And people say, don't you hate that? No, I love it. Because it holds everybody accountable.
Everybody, exactly, including yourself. Yep.
Exactly. You're right.
And that's why I record everywhere I go, because no matter what I'm doing, I'm always recording. Either I have a GoPro on or whatever, because I don't want anybody saying anything that I did differently. I treat people, like I said, with respect. I don't want to argue with anybody. I just want to peacefully exercise my rights, and hopefully we could have a good conversation like this and a good situation. And
you're right,
because there's not too many of these good situations, to be honest with you.
Well, unfortunately, a lot of times it's people, especially in this day and age, the reason why I think we're getting a lot more kickbacks of it is because of things that are happening. People are going in and filming institutions, and then things are happening to those institutions.
Mm-hmm.
Not saying that's what your plan is.
Yeah.
Not saying that at all.
Mm-hmm.
But I think people are getting more leery.
Yeah.
Because especially with the heightened, because there's been so many more shootings.
Yeah.
And stuff like that.
Yeah, and while I do understand that point, I think it's a slippery slope to to restrict certain rights because of other things that are happening in the world.
I'm not saying that. I'm not saying.
No, I'm not saying you are.
I'm not saying.
I see what you're trying to do. Yeah.
Where you get people that get a little leery.
Yeah.
Okay.
Yeah.
And I'm not saying that's a right to restrict what you're able to do.
Yeah.
I'm not saying that at all.
Mm-hmm. No, I understand that.
But it's also their right to leave. You know what I'm saying? If they feel uncomfortable because of what you're doing.
No, yeah.
That's what I was trying to say earlier.
No, for sure.
A couple of them left, and so they'll probably come back later. But
yeah, no, that's fine, and that's not what I'm trying to do. Like, I doubt if I have any of their faces on camera, to be honest with you. I stick to the walls because I understand, especially like children or anything like that, I understand that people can become upset, especially if I just stand there. Right now I'm having a conversation with you, obviously. You guys are law enforcement, you guys are filmed probably all the time, you guys don't care. Yeah. But the average citizen, I could understand that they're going to feel leery, so I try not to get them in the thing.
I can respect that.
I try and, let me get the walls, let me get the brochures, let me do this, because I'm not just going to stand there and just be like,
in your face.
I can film you because I have the right to film you because I can. And, I think it's too antagonistic and it defeats the purpose.
Well, what's going to end up happening is it's going to turn volatile.
Yeah, no, exactly.
Especially in this day and age, especially in the South.
Mm-hmm.
I mean, people, they get real.
Yeah.
they can get pretty crazy pretty fast.
Yeah.
I mean, it can go from 0 to 100 pretty quickly.
Yeah.
Depending on who you approach.
Yeah.
And that's the thing about it is also we're here to make sure that you're safe as well. That's why it's like a walk with you. That way we could keep things calm.
For sure.
That's part of the reason why I asked, hey, you mind if I walk around with you, follow you? That way, if somebody starts to get hostile, we can diffuse the situation.
Yeah, professional peacekeepers. That's what I like to call you guys.
Well, that's what we're supposed to be.
Professional peacekeepers.
That's what we're supposed to be. We're not always, but we try our best.
I think that's, I have a friend that he's an law enforcement officer in Illinois, and he told me that term. He's, we're supposed to be professional peacekeepers. And I never heard that term before, and I was like, you know what? That is the perfect term to call a law enforcement officer, because not all the time it needs to be an arrest or dominating somebody. It's to keep the peace. That's your main goal, right?
That's our goal. Our goal is to make sure that people go home, and that if
everybody's safe.
If people need to go to jail.
Of course, I'm a big proponent for law and order.
So
for sure.
The thing is, but you're right. They don't always have to go to jail.
Exactly. Well, it was great having a conversation with you. I really appreciate it. Thank you. Okay. I'm going to be getting out of here now.
Okay. Well, hey, man, we appreciate you, like I said, exercising your rights.
Thank you. I appreciate it, officer. Okay. Thank you. Sergeant, thank you. I appreciate it.
Sure.
How you doing?
Hey, how you doing, man?
There you go.
Thank you. I appreciate it. Have a good night, ladies.
You gotta give me your YouTube channel so I can go watch it.
Oh yeah, I got you. I think it'll be good for the, honestly, for the community at whole, because my goal is to bridge the gap. I don't want to. I'm a big supporter of law enforcement, law and order. I just want to make sure everybody is you know, everybody's on the same page. And my channel page is Long Island Audit.
Long Island Audit. Okay.
Long Island Audit. Remember I told you I was from Long Island? Long Island Audit, and you'll be able to find me there, okay?
All right, bud. Well, hey, like I said, you know, you're just exercising your right, and there's nothing wrong with that, okay?
Thank you. I
Like
appreciate
said,
that.
But, you know, some people, especially down here in the South, I'm just going to tell you, they don't like it.
Yeah.
And that's the cultural layer. Legally protected? Yes. Socially accepted everywhere? Not always. This entire interaction highlights something bigger than cameras. It's about trust. Between citizens and institutions. Between rights and responsibility. The auditor says his goal is to bridge the gap. The officers say their goal is to keep the peace. So, here's the final question for you. Did this audit build trust or just test patience? Let me know where you stand.
No.
I mean,
And I mean, I wouldn't, you know, like I said, I understand that I don't have any privacy in public. But again, if somebody just came up to me and started putting their camera in my face,
trust me, I know.
which is what some people unfortunately do.
Well, there's some people that do that with their audit channels.
Yes.
They get up and personal in people's faces.
And I think once you look at mine, you'll see that I'm
Well,
not like
there's
that
nothing
at
wrong.
all.
Like I said, I respect what you do, and I understand what you're doing, and I get that.
Yeah.
You know, and the thing is, a lot of people, like I said, but these businesses, you know, they get a little leery. I think it's more the leery trying to protect people because they don't know what your intentions are.
Yeah.
It's not to restrict your rights.
Yeah.
It's they're leery of what you're trying to achieve because they don't know who you are.
Yeah.
They've never seen.
Well, I
you.
achieved my goal because now that woman who didn't understand, now she understood. You explained it to her.
The thing is, you know, and that's just it.
And now
that's
she
our
understands.
job too, is to be able to bridge that gap between you and them,
Yeah.
and make them understand that this is not illegal. As long as you're not doing this, or this,
Yeah.
you're within your rights.
Exactly.
So,
Exactly. Yeah, I think you'll like it. Check it out. Okay.
Long Island Audit.
Long Island Audit. There you go.
All right, buddy.
All right. Thank you.
Be safe.
You too. Pell City Police here.